Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. How are you, dear viewers? I hope all of you are well and fine. Today in this video lecture we are going to see another lecture that is related to the electrolyte, and it is about the electrolyte blood test. If you guys remember, we have already talked about different electrolyte blood tests, like we have talked sodium, potassium, calcium, magnesium, chloride. Okay, so if you wanted to see the electrolyte test, so there will be a playlist named electrolyte and mineral blood test, so you will find all the video lecture related to electrolyte and minerals. Okay, so today in this video we are just going to see that what is electrolyte test, what are the how many tests are mentioned in the electrolyte. We will see the electrolyte test list, then we will see the diagnostic purpose, etc. Okay, so my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. So in this video, the main content which we are going to explain, first we are going to see that what is electrolyte, means introduction to electrolyte. Then we are going to see the function of electrolyte. Then we will explain the diagnostic purpose of electrolyte. Then we will see the test procedure and what are the main causes through which the electrolyte get low and high in the body. First of all, let's see that what is electrolyte. Remember, electrolyte are also called minerals, and it is that type of the minerals, or we can say it is the minerals which can carry the electric charge. Okay, and it is present in the body tissue, blood and urine. Now let's see the function of the electrolyte. Electrolyte can maintain the blood pH level. It is possible by an electrolyte which we called as bicarbonate. Moreover, it can also maintain the water balance, or we can say fluid balance, like we have sodium and chloride. Next we have electrolyte can help in heartbeat and muscle contraction. So in this case we have calcium, sodium and potassium. Now electrolyte can also help in transmission of nerve signal from muscle, heart and nerve cells to other cells. So it is possible due to the sodium and potassium. Then we have the blood clotting. So remember, electrolyte can help in the blood clotting and maintain the blood pressure. Moreover, electrolyte can transfer the oxygen to brain. So electrolyte can also maintain the bone health status, like we have calcium and magnesium. Electrolyte can also transport nutrients and eliminates the waste material. In this case we have sodium. So here I write electrolyte, but it means that it can transport the nutrients and eliminate the waste material. Now let's see the electrolyte test list and the panel which are mentioned in the electrolyte list. Contains sodium test, potassium test, chloride test, calcium test, magnesium test, phosphorus test, sulfur test, bicarbonate test. So I already explained all these electrolyte tests one by one video lecture. Okay, so the video lecture will be present into my YouTube channel. You can go back and watch. Next we have the diagnostic purpose of the electrolyte. Now why we perform this test? So this test is specially used to assess the dehydration problem, to monitor the kidney function, to diagnose heart, muscle, gastrointestinal tract and digestive tract disorder. It is also important to evaluate acid-base balance. It is important to check the endocrine disorder or hormonal disorder. It can identify the effect of the treatment which are providing. It can also use to assess the electrolyte level, either it is low or high. It can monitor the nutritional levels. Now let's see the procedure. So procedure is very simple. First of all, you need to take the blood in gel tube, red top or heparin tube. Then what will you do? You have to centrifuge it and separate the serum and plasma. Then you will run it on an advanced machine, like we have Azilite and some other advanced machine, fully automated machine. Now let's see that what are the main causes of high electrolytes. So there are different main causes of high electrolytes. So here we are going to see the important causes. First of all, it is due to the kidney disease, dehydration, excessive intake of electrolytes, food like we have salt, endocrine disorder, medications like diuretics and NSAIDs, diabetic ketoacidosis, in which this case the insulin is not produced. So what will happen? Acid will produce. So we call it diabetic ketoacidosis. Seventh, we have tissue damage or breakdown. We also call it that rhabdomyolysis. Overreaction of adrenal gland, like we have Cushing disease, burns and severe injuries. So these are the main causes through which the electrolyte will get high. Now let's see the main causes through which the electrolyte will get low. So it is due to the pregnancy, lactation, hyperventilation, like rapid breathing or respiratory alcoholism, smoking, malnutrition, poor diet, like we have Crohn's and celiac disease, excessive fluid take or loss. Okay, so these are the main causes through which the electrolyte level will get low. So this is all about the electrolyte test. I hope you get idea about this. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that. Thank you so much.